Hello, my name is Colton, and today I'm going to be talking about my personal experience with Lyme disease. I'm also going to be talking about what is Lyme disease, how you get it, the diagnosis for it, the symptoms, and the treatment for Lyme disease. I first had Lyme disease when I was in the 6th grade, and it was around Christmas, and I had it for about 2 months. It was probably one of the toughest times I had, but I made it through it, and here I am today. So, first we're going to talk about what is Lyme disease. Lyme disease is a bacterial illness that is transmitted through a deer tick. These ticks are about as big as a poppy seed, and it can feed on you for several days without you knowing. It transmits a bacteria known as Filaria burgdorferi, and this bacteria infects your organs, your nervous system, your heart, your brain, your muscles, and your joints. Some of the early symptoms of this disease may cause you fever, chills, sweats, muscle aches, fatigue, nausea, and joint pains. One of the most definite signs that you do have Lyme disease is a bullseye-like pattern rash where the tick has bitten you, and this rash is known as erythema migrans rash. Two of the main symptoms I remember having when I had Lyme disease is the fever and the fatigue. The fever, I would have around 101 fever every night, and I could barely sleep because of that. I would just eat some popsicles and it was help me through those. And the other one is the fatigue. And fatigue, I would be so weak at times that I couldn't even walk to the bathroom by myself. I would have to ask for help. So I was really weak. And then some of these symptoms would just go away at times and then come back differently. This would make it harder to diagnose it since it would be different. And after a period of time, the Lyme disease would go into another stage called chronic Lyme disease, which all the symptoms get worse. The reason they call it Lyme disease is because the word Lyme, it means the great imitator, and what it does, it mimics other illnesses, making it hard to diagnose it. So some of the illnesses that they was telling me that I had when they was trying to diagnose it was cat scratch fever, rheumatoid arthritis, and I also did a bone marrow test before they could fully diagnose that I had Lyme disease. Some of the illnesses that it does mimic are the flu, rheumatoid arthritis, chronic fatigue syndrome, and depression. This delays the correct diagnosis for it. And you couldn't just do a simple regular blood test to test for it because it will falsely test negative due to the Lyme disease inhibiting your immune system. One of the most common ways to diagnose for Lyme disease is the 2-tier test, which instead measures the patient's antibody response to the infection. What this involves is using the enzyme-linked immunosorbent assay and the Western blot. The enzyme-linked immunosorbent assay screens for the disease, and then the Western blot confirms the disease. Once you finally diagnose that you have Lyme disease, it's pretty easy to treat. It just takes time and antibiotics. So it is very hard to find and easy to cure. And that is all for Lyme disease. Thank you.